Discovering Cancer. And what some of the signs for a basic cancer were like unusual bleeding and that you can find in like a scab or something that isn't healing. Unusual chills, not to be confused with just getting goosebumps every once in a while. Unusual fatigue, fevers lasting longer and being more frequent. Loss of appetite or dramatic weight loss. Night sweats, and you kind of have to be careful with that one because a lot of older people that think they would go through this end up going through like menopause or something like that, and they have to be very careful to tell the differences. And a dramatic change in a wart or a mole. Okay, how to prevent it. Some of the basic things that normally anyone can do would be like staying away from drugs, mostly tobacco because that's found in preceding a lot of the cancer stuff. Maintaining a healthy weight, regular physical activity, alcohol intake is a big cause of that, so watch that. Protecting your skin while you're outdoors, putting on sunscreen. Skin cancer, really easy to get. Know how your family's risk, previous history, if your parents had lung cancer and their parents had it before, it'd be good to check that out real fast. And have regular checkups and cancer screenings, because if your parents had it, then it's more likely that you have it, but that's not for sure, so it'd be good to get checked out. Okay. So a sore that doesn't heal. Now some of these are more dramatic, some of them are not. So a lot of these, sometimes they'll start like this, which kind of more or likely will look like a scab. And sometimes you'll think, oh, well, it's a scab, it'll heal over time. And some of these, like this one right here, is not as common. You probably won't see that too often. But some of the other ones, you really have to keep an eye on. Redness or swelling beyond the border of the spot. Itchiness or tenderness and pain. If it's often enough and lasts long enough, you will have to get checked out. And changing in surfaces or a mole, something changes dramatically, it's not going back, you might want to get checked out real fast, because although it may be bacteria or something, you still want to get checked out just in case. Okay. Breast cancer. And I wanted to point this out that guys can get this too. Contrary to popular belief, guys can get breast cancer too. And even if no distant lump is detected automatically, don't rule it out if you suspect anything. Skin irritation, pain, redness, scaliness. A lot of times it'll hurt very, very badly to even touch it, like just a tender, very tender touch, then it'd be very, very painful. And discharge that sometimes, usually you can see it go through, say, a t-shirt if it's really, really bad. So there are actually a few things that you can do to, they're kind of like napkins that you can put on them to collect the discharge, that they actually do sell at doctors' offices and stuff, so it's actually not that bad. Sounds really bad, but it's not that terrible. Okay. And like I said, yes, boys, you can get this too, so don't think, oh, I'm a boy, I don't have to worry about breast cancer, la la la. You're just as likely to get it as anyone else. Oral cancer is basically a sore that you can get inside your mouth. Some of us may think, like, if you have ever bitten your lip and you have like a really bad sore in there, think of that pain times like 10 and lasting forever. And that's kind of what oral cancer is like. Sometimes people have it like feeling caught, like some something's caught in their throat that they can't get out, and this will go on for a long time. Difficulty chewing, swallowing. A lot of times it hurts to talk when they have this. Swelling is not that common, but sometimes it happens. And horses. Okay. So people usually over the age of 40 are likely to get stuff like skin cancer, and that's not ruling out people younger than that, but it's just they're more likely to have it. Some stuff to prevent it would be like self-examine each month, so it wouldn't be that bad. Am I missing stuff? And everything should be checked out by a doctor before any treatments are concluded. So if you think you have something, don't go and get a bunch of treatments because it may just be something else.
No questions yet. Please hold on to your questions.
Go.
That's not showing.
Okay, it needs to stay quiet, right? No.
Well, good job.
Is it okay if this is still running?
Yes, this should still be the one.
Are they doing like all types of kids?
Yes. Okay, go ahead, take it away.
Okay, so to start off, this might not have been mentioned, but me and Amber had two different things we were defining. She was defining self-examination, I'm just defining screening. So basically, to start off, cancer screening is different than self-examination because for self-examination, you are looking for visible signs of the particular cancer you might have, while screening is for when people don't have necessarily symptoms or signs. And yeah, so screening for cancer. For breast cancer, it would be a mammogram, and there are two different types of mammograms. There is screening and diagnostic, and basically what the screen is you're checking for breast cancer that does not have a sign or symptom. Yes, to that disease, and then diagnostic is after a visible sign is found, like a lump or swelling. For prostate cancer, it is called a prostate specific antigen or PSA test. And basically, what this test is used for is it detects the PSA level in your blood. So if you have a relatively high PSA level, there's a good chance you might have cancer in your prostate. And for detecting prostate cancer, this is not the only thing they use. They also use a digital rectal exam. And you can pretty much tell what that is. And it's recommended among men who are 50 and older. For cervical cancer, it's called a Pap test. And Pap test, it detects abnormal cells within your cervix, or basically cancer cells. But it does not detect non-cancerous symptoms like irritation and other things like inflammation. So, even though screening is not used is used for people who don't have symptoms, it doesn't mean that there's still not symptoms present for the cancer the person has. For prostate cancer, for early stage, there might not be symptoms necessarily to start, but later on there will be symptoms. And they can range from anything from difficulty in urination, there might be blood present in your urine, or your semen, and then there can also be leg swelling, or bone pain. For cervical cancer, there could be vaginal bleeding, pelvic pain, and vaginal discharge could contain blood.
Anyone? Does anyone have any questions? Dorian?
Well,
Hey, pay attention.
what are your slides that you just had? It said like bone pain? Is that like bone pain like everywhere? Just like in your legs?
Yes, probably should have put more emphasis on that, but what I mean by bone pain is in the general area of where your cancer would be.
Pelvic bones.
So yeah,
Yes.
so if cervical cancer would be in your pelvic area, and so on.
And don't confuse it with just like if you were to bump yourself, it'd be a not constant pain that would never go away. Rachel?
For the screening test, what are the procedures for that? Do they just like go in and get a screen for vagina?
How's it done, or?
Yeah. You know?
Yes, cancer screens are usually done with the presence of a doctor.
Yeah. Well, yeah.
These are not necessarily something you can do by yourself.
Well, yeah, I know. But, like, do they have like this whole giant machine, or is it like an X-ray type thing?
It varies for the type of cancer.
Usually it's a machine, isn't it?
Mainly machine, yes.
Usually it's a
But
machine.
there's also laboratory tests that they can do, like they can take blood for PSA test.
Okay.
Any other questions?
That's time.
Okay, thank you.
Perfect.